All right, so here's part 2 of going through the muscle groups and some of the dysfunctions involved. And we'll continue from here where we left off last time. So, a couple of things. Let's go here. This is called a biceps. I want to show you guys something. It's not called a bicep. No such thing as a bicep curl. I know everybody says that, but it's biceps. You see there's 2 heads with 2 origins. The 2 origins are where the plural comes in. So this is a biceps. This is a biceps. And if we flip it around here, we've got, see if we 1, 2, 3. That's triceps with 3 origins. And so each one of those is a triceps, okay? So we talk about tricep pushdowns, no such thing as triceps. But again, that's just some anatomy for you, okay? Now we're gonna come down. We talked a little bit about the some of the branches going into the median nerve. I didn't mention median nerve, but some of the branches from the brachial plexus coming down and getting trapped last time with scalenes, possible pectoralis minor. We've also got this muscle right here. This one is called the pronator teres, and that can actually trap the median nerve coming down because it comes down around and then goes right through the palm there, okay? So that can cause some pain, tingling, numbness in the thumb and hand. If we can also get the median nerve trapped, and probably the most common area to get trapped, let's see, let's zoom this in a little here. The most common area is right here. So we've got this band that runs across that actually traps all of these flexor tendons, not traps it, but kind of covers it and keeps them, you know, inside there, right? Stabilized in there. And this is called a flexor retinaculum. This side, these are flexors, the palmar side, and then the back side, the posterior, those are extensors, just so we get a little more anatomy there. Okay, so we can get the median nerve trapped. If that gets really tight, or those tendons thicken up, creating less space in that carpal tunnel. There's a tunnel made up of carpals, which are wrist bones. This runs across the carpal tunnel, this flexor retinaculum. So if that gets tight, or the tendon sheaths get thicker with these flexor tendons, it can trap the median nerve in there, again causing carpal tunnel. We get some tingling and numbness into the thumb there, a little bit of the palm of the hand, so all this area here. Could be pain, could be stabbing. I mean, there's a lot of different ways it presents. Okay. So what else we got? So we're gonna keep those muscles loose, right? As best as possible. Now, let's talk about tennis elbow. So we go over here, we've got this muscle called the brachioradialis. It is a synergist with the biceps, and it helps flex the forearm. So the biceps flexes and supinates. Supinates means to turn the palm up, okay? Or palm forward, depending on where the arm is. Palm forward here, palm up if you have the arm flexed to 90 degrees. So you've got brachioradialis there. That's going to be our landmark. So we're going to go over, remember we're on the extensor side if we're on the back side. We have the extensor carpi radialis longus, and then this one right next to it called the extensor carpi radialis brevis. Let's see if we could track that right to the bone there. Okay, so hopefully you can see what I'm showing you guys. Trying to look and show you at the same time. Now, the reason I'm mentioning these, this muscle here, the extensor carpi radialis brevis, is the one that is involved in tennis elbow, okay? So it's usually from overuse, and that will cause inflammation in there, in those tendons and the attachments, and then, cause tennis elbow. So that's the muscle that needs to be worked on for tennis elbow. By the way, radialis means the radial side, so when we're looking at the bones, the radial side is the thumb side. There's a radius and an ulna. The pinky side is the ulna. The radial side, the lateral side is the radial side. So that's the thumb side there. So that's how they're named, right? Radialis and ulnaris, we have those types of muscles, all right? Now, if we talk about golfer's elbow is actually at the medial epicondyle, which is a portion of the bone here, okay? The flexor tendons is called a common flexor tendon. So I mentioned that they're down here, right, attaching, going underneath the carpal tunnel, but they all come up here and they insert into the medial aspect of the elbow called the medial epicondyle. And so those flexor muscles are what get involved to inflame that tendon and cause golfer's elbow. So those muscles are the ones that need to be worked on for that, all right? Let's go down. I may have to break this video up one more time. Yeah, let's stop the video here and we'll do a third one. So that gives us, actually, let's see if we have anything else back-wise. Yeah, I think, oh yeah, let's just do this last one and then we'll end it here. So this right here, So it's hard to see the separation, but this to this, let's outline that, hopefully you can see that. That is called the rhomboid minor. From here to here, that is called the rhomboid major. If those get weakened, this shoulder blade will flare this way. It will flare out. Remember we talked last video about the winging of the scapula. If the serratus anterior get weak, this is a flaring. So we need those muscles to keep that nice and tight in there. Then the last thing I'm going to actually say today, let's pull this. Let's see. Actually, that's not going to come off together. I'll have to keep it all together. So if we look, rotator cuff muscles, there are 4. We have above this spine of the scapula, we have the supraspinatus. We've got to strip away the trapezius muscle to see that. Underneath the spine of the scapula, we have the infraspinatus. And then right here, we have what's called a teres minor. If we go, I guess I don't have one that shows it. Yeah, I don't have one that shows it. But if we went to the anterior side, the front side of that scapula, aka shoulder blade, there's a muscle that sits in a cavity called a fossa. It's called the subscapularis muscle. That's the 4th rotator cuff muscle. So supraspinatus, infraspinatus, teres minor, and on the front side, subscapularis. Those are the rotator cuff muscles. There are 4. This one down here is teres major, but it is not part of the rotator cuff. All right, let's end it there. We'll finish up in the next video.